Hi everyone, this is Dr. Merhuat here with Elite Sports and Spine Chiropractic. Today I have a special guest, Dr. Darren Holmes with us, the owner of Elite Sports and Spine Chiropractic. We're going to be going over what a CCSP is, a Certified Chiropractic Sports Physician. Both Dr. Holmes and myself are certified chiropractic sports physicians, so we're going to do a little interview. Dr. Holmes is going to answer the questions and I'm going to ask him. So first one to begin with is what are the educational requirements in order to obtain CCSP?
So CCSP requires a couple different things. First off, you have to have, without a doubt, a chiropractic certification. It has to be maintained. As long as you have that, you can take that next step to obtain the certification in CCSP. First, CCSP stands for Certified Chiropractic Sports Physician or a practitioner, depending on the state that you're in. So what it requires on top of it is 100 hours of educational requirements specifically focused on the sports medicine program. During that process, you learn a multitude of things, including emergency procedures, focusing on first aid, understanding how to manage a case if you're on the sidelines. In addition to that, understanding mechanism of injury associated with that specific sport that you're working with, and so on. So we do require, in addition to that, a board certification exam that kind of focuses on 250 different questions that focus solely on sports care. On top of chiropractic, we build upon the actual program that we have from our original chiropractic degree. The way that you can obtain that or kind of bypass the 100 hours is through a sports master's program. I know that you and myself have both done that. We had to go through a master's program that was associated with really a sports exercise science type rehabilitation program, or you can have an active athletic training certification degree as well.
Okay. So being after maintaining and getting that certification, what kind of sets you apart from other chiropractors that are in the field and even other doctors in the field?
So definitely sets us apart in the sports world. Traditionally, chiropractic, we're focused on kind of correcting joint issues associated with any type of movement restriction. We're very good at that when we exit our program, even just at the entry level into practice for the first time. We also, before you go into the sports certification, pretty good at manual muscle type treatment, but we are able to enhance that procedure during the process of obtaining and farther on past the CCSP program itself. We focus on active rehab as well. Dr. Merhuat and I both definitely work on active rehab and care in the office. If you're watching and you're a patient, and many of you know that that's what we do. You've come to know that and expect that at our facility. But traditionally in the chiropractic world, that doesn't happen. If you don't have a certification that's involved with this type of procedure, like a CCSP or some of the other certifications that are similar, definitely is not commonplace to perform.
Okay. So there's other certification past the CCSP that you can obtain. I know right now Dr. Holmes is trying to obtain that through two different tests. One he already passed, the other one he's actually scheduled to pass. And then myself, I'm going to be working towards that as well. Give us a little insight on what that is and what the steps are to obtain that.
So kind of, well, first off, the program itself is called DACBSP. It kind of sounds complex and convoluted. What it stands for is a diplomate of the American Chiropractic Board of Sports Physicians. Essentially what that does is it think about kind of a resident versus an attending physician in a hospital. It kind of, without the hospital walls themselves in play, that's kind of what we're working with there. Essentially, the CCSP is the stepping stone where the resident and the attending would be the diplomate program, the DACBSP. So to obtain that, you have to have an active certification for CCSP and active license, of course. All of the other requirements we recently discussed in this video. And in addition to that, we have to obtain an additional 200 hours of training. So this 200 hours have to be approved by the ACBSP, who is the governing body for these two programs we're talking talking about the American Chiropractic Board of Sports Physicians, and then an extra 100 hours has to be in the field. So they want us to obviously establish that we have hands-on practicality. The CCSP requires hands-on practicality as well, but for examination purposes, it's just a written exam. The diplomat also requires a written portion, which is very similar, but kind of beefed up a little bit to understand a little bit more knowledge and more clinical basis for what we do. And other than that, we kind of have to make sure that we maintain the certification. So with that process in mind, it requires double the amount of continuing ed requirements annually for compared to the CCSP.
Okay.
Pretty cool.
So there you have it. Dr. Holmes and myself, both certified chiropractic sports physicians. If you are an athlete or an active member with workouts, whatever it may be, and you have some type of sports-related injury or other injuries that's not related to the spine, feel free to contact us because we treat those things every day based on the certifications that we have. If you have questions about what we discussed today or other questions unrelated, feel free to post those in the comment section. We'll be happy to answer those. I'm Dr. Merhuat here with Dr. Holmes with the Elite Education Series, and I hope you join us next week.